The Auditor-General provides assurance to Parliament on the accountability and performance of the Victorian public sector. The Auditor-General conducts financial audits and performance audits and reports on the results of these audits to Parliament. On the 29th of May 2014, the Auditor-General tabled his performance audit report, Accessibility of Mainstream Services for Aboriginal Victorians. The Victorian Aboriginal population was 47,000 at the 2011 census. This is an increase of 40% on the 2006 population due to high rates of migration, high birth rates, and an increased willingness to identify as Aboriginal. About 55% of the Aboriginal population, compared to 26.2% of the total Victorian population, lives in regional centres, such as Mildura, Shepparton and Portland. The remainder live in metropolitan Melbourne. 55% of the Aboriginal population is under 25, compared to 32% of the non-Aboriginal population. Aboriginal Victorians are more disadvantaged than the rest of the population, with higher perinatal mortality, lower birth weights, poorer overall health status and higher hospitalisation rates. Aboriginal people report higher levels of psychological distress than the rest of the population and have poorer overall health status. Past government policies of forced removal have impacted significantly on the Victorian Aboriginal population, and this can affect the way government services are perceived. The Victorian Aboriginal Affairs Framework, or VAF, was released in 2013. VAF is a whole-of-government strategic reform agenda that aims to improve the quality of life of Aboriginal Victorians with engagement arrangements and stronger governance and reporting arrangements. VAF commits to specific targets in maternal and early childhood health and development, education and training, economic participation, health, housing, justice and culture. VAF emphasises a holistic life course approach for Aboriginal affairs, which recognises the important role that access to services plays in influencing a person's life, and that increasing the take-up of services is the first step toward improved outcomes for Aboriginal people. VAF replaced the Victorian Indigenous Affairs Framework, the previous whole-of-government strategy. VAF provides the mechanism for integrated action across government and includes 7 access criteria designed to provide better access to services. The overall objective of the audit was to assess the accessibility of mainstream services. The audit's 4 criteria were to assess whether departments had a sound understanding of the service needs of Aboriginal people, had developed and implemented effective plans, programs and strategies to facilitate access to services for Aboriginal Victorians and to address identified needs, demonstrated how improved service access has contributed and is expected to contribute to improved outcomes for Aboriginal Victorians, and had effective monitoring, reporting and evaluation frameworks in place on service access that demonstrated the achievement of intended outcomes and was underpinned by reliable data. We defined mainstream services as services that the general population is entitled to access, including kindergarten, maternal and child health services, hospital services, public housing and homelessness services. While some of these services require specific eligibility criteria, anyone within the population who is eligible is entitled to access them. The audit included the Office of Aboriginal Affairs Victoria at the Department of Premier and Cabinet, or OAAV, the Department of Health, or DH, the Department of Education and Early Childhood Development, or DEECD, and the Department of Human Services, or DHS. The audit examined access to mainstream services for Aboriginal Victorians. This included targeted programs and strategies designed to support access to these services. Examples of targeted programs supporting access include free kindergarten for Aboriginal children, locally based outreach services within maternal and child health to reduce transport barriers, and the Improving Care for Aboriginal and Torres Strait Islander Patients program, which aims to provide a more welcoming environment in hospitals. The audit team consulted broadly both in metropolitan and regional areas. This included consulting Aboriginal community-controlled organisations, Aboriginal peak bodies, Murap Barak, the Melbourne Institute for Indigenous Development, government departments, Victorian Equal Opportunity and Human Rights Commission, Victoria's Commissioner for Aboriginal Children and Young People, and local government. The main conclusions from the audit are that despite departments developing many programs to assist in closing the gap, there has been little improvement in outcomes, and in some cases the gap has worsened between Aboriginal people and the rest of the population. There have been some improvements in service access, which is encouraging and realising some benefit. There is an absence of effective leadership and oversight by the Secretary's Leadership Group and OAAV. Limited oversight means that there is little accountability as to how individual departments develop and implement their own plans and apply VAF, although there are some new oversight arrangements being established. Other conclusions from the audit include that OAAV has recently moved to establish an interdepartmental Aboriginal Inclusion Working Group, which is intended to provide for cross-government coordination and oversight of departments' inclusion action plans. And, with the exception of the DH, departments do not undertake robust evaluations of Aboriginal-specific programs and of Aboriginal access to services to determine if services and programs are delivering positive outcomes for Aboriginal Victorians. There are weaknesses in data that mean it is difficult for departments to understand whether all eligible Aboriginal people are accessing relevant services or programs. This is demonstrated in significant variability in population estimates between the Australian Bureau of Statistics, local service providers and local governments. Departments have not reviewed or updated their relevant plans to reflect VAF's focus on service access and to specifically address the 7 service access criteria. A lack of effective collaboration and coordination exists in planning and service delivery between departments and service providers and at the service delivery level between local providers. There is some evidence of improved service access in maternal and child health, kindergarten, hospital services, public housing and homelessness services, and some improved outcomes. For example, there has been an increase in identification rates in hospitals, and fewer Aboriginal people are leaving hospital without treatment or against medical advice. However, improvements may not be sufficient to meet VAF targets, for example, in relation to closing the gap in kindergarten access by 2014. There is limited evidence that the Secretary's Leadership Group is fulfilling its role, which is to oversee VAF implementation and coordinate departmental activities. The new Interdepartmental Aboriginal Inclusion Working Group may improve coordination and oversight. There is inadequate community consultation, which needs to be improved in line with VAF and COAG principles. These require Aboriginal community members to be engaged at all stages of program development, implementation and evaluation. This would provide a broader range of independent views. Cross-government coordination needs to be improved to successfully implement VAF and reduce the siloed approach to service delivery. This involves collaboration between departments to ensure that the VAF access criteria are applied to service delivery and to ensure that services are accessible. We made 6 recommendations listed on the next 2 slides to the Departments of Health, Human Services and Education and Early Childhood Development. All departments have accepted these and provided an action plan detailing how and when recommendations will be addressed. We also made 2 recommendations to the Department of Premier and Cabinet. The Department of Premier and Cabinet has also accepted these recommendations and provided an action plan detailing how and when these recommendations will be addressed. Previous audits that are relevant to this report include access to services for migrants, refugees and asylum seekers, access to education for rural students, Indigenous education strategies for government schools, and coordinating services and initiatives for Aboriginal people. All our reports are available on our website. If you have any questions about this or other reports, or if you have anything else you would like to discuss with us, including ideas for future audit topics, please call us on 03 8601 7000 or contact us via our website.